Hello everyone, my name is Chris Williams. I am the owner of Emeritus Health and creator of Balance University and also Naples Soccer Training. I've had a lot of folks ask me about our foam roller and why these are important. And I'm going to explain that to you in this long-awaited video. So our muscles, they stretch and contract throughout the day, throughout life, throughout sporting events, throughout work. And so they're put under a load and then they're at rest when we're sitting, when we're sedentary. So as we go through life, especially as we work out and we exercise, we tend to form adhesions. Most of you guys have experienced this with a knot in your shoulder or in your leg, and you feel some kind of adhesion and uncomfortability, and you use something to roll it on, and you just want to lean your back up against something and smash this knot. Or when you go get a massage and they give you a deep tissue massage, what they're using is a technique called SMR, or self-myofascial release. Before we get that far, let me back up. As our muscles go through life, as we go through life and things stretch and contract, these muscle tissue, they stretch and contract these muscle fibers. What tends to happen is we form little knots. And I want to be very careful when I say that, because really they're not knots, they're adhesions. So you have to imagine, how long was this band before I tied a knot in it? Let's say this was a mooring line that was 10 feet long. All right, and as we go through athletic events, as we advance through our careers in sports or in life, we sit and we stand, and these muscles contract, we form more and more adhesions. Now that mooring line is getting shorter and shorter. Now if this is your muscle, which is what it's representing, then now can this muscle work through its full range of motion? Not even close. Let's say it can only function through 75 or 85% of its range of motion. So now what happens is we get a bit of dysfunction or pain. And so we also now are asking other muscles to do their job, or do a job that they're not required or supposed to do. And so now we have a muscle that becomes very strained and overactive. We have a lot of muscles that become underactive because they can't just simply perform what we ask them to do. Now, if I'm a soccer player and I want to change direction quickly, and I have a muscle that has tons of adhesions, what's going to happen whenever I go to create that torque and I take off? That muscle can tear or strain. We're at a higher risk of that muscle strain. So what we do when we go get a massage in self-myofascial release, or when we use our foam roller, is that we roll up and down, and I'm going to show you the exercises. This is the explanation. We roll up and down until we find the place that hurts the most. Generally, that is the knot. How many of you have kinked a water hose in your life? Right? The water hose is on, you kink the water hose, you hold it for 10 seconds. What happens when you let go of that water hose? That water goes rushing out of there with force. It's the same thing with our blood vessels, right? If I put my finger on my arm, I am closing the blood vessels, the capillaries in the venule, and this part of my skin, right? And that pressure from all the blood trying to get through in my epidermis and subcutaneous tissue there, that blood is trying to get through. However, it cannot. It's building up on the outside. So when I let go, that blood rushes in. Well, it's the same thing with what we do with our knots. We sit on a foam roller, we hold that adhesion, we stop the blood flow, we then roll again, and the knot starts to unwind. Over again, day in and day out, as proper maintenance, injury prevention. And now all of a sudden, with all the work that we're putting in, we have a muscle now that is at its full range of motion and is able to handle its load capacity and work the way it's supposed to work. I hope that makes sense for you. If you have any questions, give me a call, shoot me a text, shoot me an email, and I'd be happy to answer them. Let me show you some exercises. Okay, now let me show you some exercises. And this is just the basics. There's all sorts of videos you can find on YouTube, but this is something just to get you started. that will help you maintain your body and help you to continue to use those muscles and lengthen those muscles to prevent injuries and have the healthiest athlete from a muscle tissue standpoint as possible. So whenever I foam roll, I always want to start with the seam of my pants. I have my TFL and my IT band. Now, this video, I'm not going to throw a lot of science because what this is for is to educate you on how to roll. All right, if you have any questions about the science of it, feel free. I don't want this video to be a 35-minute video. This is going to be short, sweet. This is how you do it. So I always want to start by rolling the seam of my pants, my TFL, my IT band, all the way down to my knee. So I'm going to start at my hip. I'm going to lay down. I'm going to extend my leg behind me. I'm going to cross this leg over. Let me see if I can get to a place where you can see me. And so what I'm going to do is I'm going to start here and I'm going to roll all the way down. Let me get it at an angle here. So I'm going to roll all the way down and I'm going to crawl. Now I want to be careful. I don't want my leg moving forward. I don't want to look like a C. I want to be straight. And I'm going to go all the way down to my knee. And then I'm going to go all the way back to my hip. Here's a tip. If it hurts, you're doing it right. I want to find the place that hurts the most. Now, you can tilt your hips slightly. You don't want to tilt them this far and you don't want to open up, but you can have subtle turn to the front and a subtle turn to the back, or anterior and posterior. And we want to find the place that hurts the most. We're going to stop on that place. You should be gritting your teeth. And you're going to count to 20, 15. Once you reach that 15 or 20 second mark, then you're going to go up and down again. Find the place that hurts the most. It may be the same place. It may be a new place. Find that place, stop, and count to 20. You're going to do both sides. You're going to go up and down, stop, 3 cycles. Okay? Now, if you don't have time to do that, that's fine. Something is always better than nothing. After I do both sides, then I want to sit on my foam roller and I'm going to roll out my glutes, which is going to hurt like crazy. So the way I do that, I'm going to take my right hand, put it on the ground there. I'm going to take my right leg, cross it over, and I'm going to lean to the right. And this is where the pain really begins. This is where you're really going to start to feel it. And again, I'm going to go up, and I can turn a little to the anterior, to the front, and I can turn a little to the back. But I'm going to go up and down and do a little bit of exploration here, and I'm going to find the place that hurts the most. When I do, right there, I'm going to hold that for 15 to 20 seconds. And again, I'm going to go through 3 cycles on both sides. And then for a lot of us, especially when we're playing sports, our calves get tight. Now, we have 2 muscles in our calves we want to focus on. We want to focus on the gastrocnemius and the posterior tibialis. And what that means is I'm going to have my foot one direction, and then I'm going to turn my foot and aim the other direction, not try to go right down the center, okay? So I've got my foot. I can cross this over. I'm going to lift myself up in the air, right? So you got to have a little bit of upper body strength. If you don't have that strength, then you just simply slide. Slide yourself. You're going to go up and down. If this is too painful, take the foot off. If you need the foot to help you get up and down, take the foot off and use the foot to help you get up and down. The muscle there. So I'm going to find the place that hurts the most. I'm going to sit. Put my other foot across that leg to provide a little bit of weight, and I'm going to hold, count to 15 or 20. And then I'll simply take my foot, turn it the other direction, hit the muscle on the inner part of the calf there. And again, I'm going to go up and down. Find the place that hurts the most. Stop, put my leg on over the top of it to let it weigh down, and I'm going to count to 15 or 20. And I'll do the same thing for both legs. Guys, we can do our quads. The way we do our quads is we'll lay down. We're going to take our leg and bring it out to the side. And again, you're going to go up and down. That's a terrible view, but you get the picture. Let me see. My chest is going to be facing the ground, and I'm going to go up all the way to my knee and then down. And again, you can roll to open your hips up a little bit so that you're rolling your vastus lateralis, the muscle on the outside of the leg. And then you can turn to the inside and roll your vastus medialis. That's it, on the inside. So anyhow, that's foam rolling 101 quick version. I hope this helps you. If you have any questions, guys, you know how to get a hold of me.